Being a parent is a blessing where, while we cherish our experience with the little ones, we are constantly worried about playing our part properly in their upbringing. We just want to get everything right, from trying to introduce to them the sense of right and wrong, to help them build their self esteem, from understanding their needs and demands, to navigating them in the right direction. Parenthood is a roller coaster. But if you have the right knowledge and are well informed, that makes your life so easier. That's the motivation behind today's episode with the expert. Hi everyone, welcome back to the channel. In today's episode, I am having a warm conversation with a caring developmental pediatrician, Dr. Ripudaman Singh Minhas. His research interests are in the development, behavior, disability, and rehabilitation of children in urban settings and in newcomer families. We talk about how to understand our children's behavior and create a safe space where they feel comfortable to communicate. We also discuss how to encourage them to learn and grow, how to help them build good habits, and what it really means to live with ADHD. This episode is for anyone who cares about helping children thrive. Whether you are a parent or a caregiver or just somebody who wants to understand more about childhood development. If you're looking for practical tips or just a reminder that you are not alone in that journey, then this episode is for you. So grab a cup of coffee, relax, and join us as we learn about how we connect with and support our little ones. Thank you. Thank you, doctor. Thank you for doing this. I have with me Dr. Ripudaman, who is a developmental pediatrician working in Toronto. And I'm so glad you could take out your time to do this. Thank you very much for that. Starting with the main things that you deal in developmental issues or behavioral patterns in kids. What I would like to know is that how can I create a safe space where me and my kids can communicate? Meaning a safe space where they are not afraid of telling me anything they are finding challenging or a problem that they are facing. That can be, for example, bullying in the school or any inappropriate behavior from an adult. That can be anyone. And or even if they have committed any mistake and they're not afraid of telling that to their parent, and they feel safe that if they will share that, they could get a solution out of it. How do I make that, create a safe space around that parent and kids relation?
Yeah, that's a great question. I think it can be tricky. I think the first step is like what you're talking about is just actually pausing to think about it, right? As a parent, we may often worry about our child's behavior, worry about the repercussions or the impacts of those behaviors. So being in a situation where you're actually hoping to listen, to understand the child, whether they have words yet or not, even when we're talking about toddlers,
Right.
but creating a situation where the child doesn't feel fear or shame, but an opportunity if they make a mistake, but to be able to learn from it. So I think creating a space where they can express themselves and allow you then to guide them in understanding and processing their emotions. Some of that also comes from how we model for our children. So I think many times kids grow up not seeing their parents or caregivers make mistakes. Or at least not thinking that they see them, right? And so I think it's important for, if we make a mistake as an adult or as a caregiver for a child, for us to be able to have the humility to be able to apologize if we've done something wrong to the child, or if we made a mistake, or even to our partner, being able to do that. So the child sees that they're not the only one that's being expected to apologize or not make mistakes, but understanding that we all do this. And then that creates an atmosphere where it's okay to make mistakes and make space to discuss it and to be able to learn from it and moving forward as well.
Okay. So we can say that it's copy and paste basically. So if they see me, if they see a parent, they have done a mistake and they're admitting and they're talking about it, they feel pretty much confident about they can do the same, or there's not gonna be a big bashing or anything like that, so that they feel comfortable or maybe safe is the word that around it. Okay.
Yeah. I think with that also, I'll just add, when we think about consequences, right? Or when we think about, even the word discipline comes from the word actually that means to teach, not to punish. right? And so when we're thinking about discipline, it actually is, the idea is this a teachable moment? So if the child has done something that we think is not favorable, we think there might be a mistake, that's actually a teachable moment. So rather than to, and that's hard for us as parents where we may not have been raised that way,
Very.
right? So you're talking about the copy paste phenomenon, right? In terms of what we experience, but being able to break that cycle and say, hey, you know what? Whatever just happened here or whatever I observed or learned about the child's behavior is making me feel mad or angry or whatever it might be. So sometimes you need to take a break as a parent and say, you know what, we're going to talk about this in 5 minutes. But then when you come back and thinking about from this, your interaction, what is the child going to learn? I think that's really important. They learn from what they're hearing from us, but also what they're seeing from us as well.
Right. Right. Uh, you talked about teaching and disciplining. Uh, this is a very online talk of the town, I can say. There was a recent episode of Yuvraj Singh's father online. We Everybody know who Yuvraj Singh is. He's a world renowned cricketer from India, and we are proud of what he has done to the game. What got my attention is that in one of the episode, Yuvraj Singh said that he was not fond of cricket when he started playing, but his father insisted on or pushed. I can use that word push because he said exactly like that his father made him play. He wanted some other game, and he also got a gold in that game which he wanted to play. I guess that was skating or some other game.
Mm.
But and he only got gold because he was afraid that his father will not accept bronze or silver. And then later on, when he was pushed to play cricket, and eventually in like 1 or 2 years, he started having interest when he saw that he can do something in that. My question is, this cannot work in 100% of the cases. The line, and where do we know that I need to push my kid only up to this extent and not else? Because sometimes we have to do that because they are not in a position to decide what's good and bad for them. When do we, or what's the line that we do not need to cross in this situation?
Yeah, it is. This is a very interesting example, and I think really looks at different parenting styles, and I think more and more we're understanding when we push or pressure children to do things. The style that happens is very important. There's been a lot of research that talks about the mental health impacts long term related to
Correct.
this as well, right?
Yes.
So this is a very extreme example where you've got someone who's in that 0.1% who's made a
Right.
career and become a world class,
Right.
athlete related to this. There's lots of other people, and like you were saying, it's not 100%. It's the flip, right? It's barely less than 1% of people that do
Yes.
it,
Yes.
and I think it comes back to thinking about for someone who's a parent, either on their own or as a parenting couple, right? Thinking about what are your goals for your child long term, right? And I think thinking beyond a gold medal or a trophy, but what are the characteristics you want your child to have? Because when a child is younger, for us as parents, it can feel very inconvenient if they're very, headstrong, or they seem stubborn, or if they are, tantruming and doing these things. And part of that is, we have to support them in how you function within society, within school, to be able to be a part of those processes, in the long term, to be successful and to find their place within the community. However, those are the same sort of characteristics, though, that as an adult, if used appropriately, if harnessed, can be very strong leadership skills. You want your child to be able to advocate for themselves, to be able to look with confidence at what they would like to do for a career, be able to balance things with their family and friends and those sorts of things. So you want them to build their independence. And the tasks, when we think developmentally, for all children, their job is to slowly build enough skills that they become independent from us. And that's hard for parents to think about when we're thinking of them as babies, right? And we want them, there's something comfortable and lovely about that, to be able to stay. But if you do your job well as a parent, your child will need you less and less. right?
Right.
And so I think when we think about that, and most of us, I think, would want our child to grow to a point where they feel independent, they feel confident, they're able to have meaningful relationships and friendships in their lives. And hopefully there's this whole Japanese concept of ikigai, which is, being able to, there's 4 points about where you find where is a good balance for yourself as an adult, is finding a career that, pays you well, that gives some service to your community or society, that you're good at. And I'm trying to remember the fourth concept as a part of that as well. But the idea is that there's something that is here, characteristics of what we would like. Not necessarily you have to be a cricket gold medalist, but we'd
Right.
like you to be someone who has these characteristics. The challenge with that, as we go back to Yuvraj's story, is that if that is your whole identity growing up, to be a cricketer and a gold medalist and to do these things, and on that day for the final match, the other person has a better hand, or there's some twist of fate that you don't win, then what is your identity?
Right.
Right? And then that's where we see, there's so much concern around pressure and resilience, or with leading to anxiety, depression, those sorts of
Right.
things as
Right.
well. So I think, thinking about, again, what is the greater goal? When you think back, what is what are you envisioning for life like for your child, and what are the steps, to build those skills? And one of the skills I think we don't often talk about enough is resilience, right? That
Right.
idea of bouncing back. We're all going to have hard times in our life.
Yes.
But how do we teach our children to be able to bounce back and to be able to get back on track when things get tough?
I think it makes sense because the thing that you said, that how you see your child, or how do you want to look at your child, or what you want your child to.
And I think more and more, it's hard, like I was saying, for parents to be able to let go of some of these things. I think, what I'm see, both certainly in my work and also from a research standpoint, what we see is, you know, a good balance often, especially as children approach adolescence, when you have to let go a little bit, is thinking about, helping them explore. So giving them lots of opportunities to figure out what are the things they like, what is the stuff that they're good at, right? All of those sorts of things which are fulfilling for them. We know that if you do something you're good at and you enjoy, you're more likely to stick with it longer,
Right.
right? To feel more motivated, to have more resilience with it. So if you have to study for an exam for it, if you have to go practice for it, if you don't get that first job interview, you have your own internal motivation rather
Yes.
than pressure from other people, right? To be able to
Right.
stick with it. So I think we have this notion that we mold our children. And there's this thought where we actually shouldn't be molding them. We should be helping them to unfold, to be able to discover who they are,
Right.
because so much of that is already wired as well as a part of how their brain and genetics and their experiences are from early on.
Correct. How do I differentiate between if a kid is being resilient or a kid is being stubborn because he is acting tough in certain situations? Can he pick up as a personality trait? For example, we go out, he wants something, an unreasonable demand, uh, and he's acting tough on it. Kind of, does he start picking up those traits in his personality if I do not listen to his demands again and again and again? How do I differentiate between, like, if sometimes he starts throwing tantrums, if I am out, we are out on the shopping or maybe just having a family time, and if he makes an unreasonable demand, and if I do not listen to him or do not want him to get what he's asking, does he develop that as a personality trait that he'll have to say again and again, or maybe cry about it? And because that's a very, very first thing that parents think, that he's going to develop a habit of crying and getting things done. How do I differentiate between when to give in to his tantrums or when to not? Because being resilient and being stubborn, these are two different things, but often confused as one.
Yeah, that's a great question. And I think it's very common. It's important for us to think about the child in their developmental stage. So we know for children who are, in that first year of life, it's not really possible to spoil them early on, right? So, especially in the first 6 months, if a child is crying, They need their comfort, they need to build their attachment and know that if they cry, that their parent or their caregiver is there, that it helps to build that strong bond.
Right.
It becomes different when they're up and about and they're walking, right? So for typical development, we're thinking 12 months or so, kids start getting up and about and walking. They become toddler aged,
Right.
toddler
Right.
level.
Right.
They sometimes call it, as they get closer to two, the terrible twos. We
Okay.
sometimes joke they're
Yeah.
terrific twos, right? But
Yes.
that's a point where developmentally they are able to usually express their demands. They're able to physically demand things, grab things, move about in their environment. But social emotionally, they don't yet understand that the other people around them have different priorities. That's where
Right.
you get these
Right.
tantrums happening because they don't know how to regulate themselves. They don't have that level of empathy yet developed where mama or dada wants something different from me, or I can't do this, but I want it now, and I can tell you that I want it, right?
Right.
So that's it.
Right.
Tantrums are typical development. This is like we were saying earlier, they're starting to exert their independence. They're starting to tell you, this is what's important to me in this moment.
Right. Right.
So, what do you do in those situations? And of course, it's different as children get older and turn into youth
Mm-hmm.
and adolescents. But generally, the idea is kind of what you're alluding to is this idea of positive and negative reinforcement. So, if a child, you know, if a child has a certain behavior, there's a motivation behind it. All behaviors have a reason behind them, right? And they can be various things.
Okay.
So, one way we think about it from a developmental and psychological standpoint is we think about ABC. A is antecedent. So, what happens right before the behavior has happened? B, what is the behavior itself? How long does it last? What does the tantrum look like? And then C is what is the consequence? What happens afterwards or what makes it stop? So, for example, you know, you are a couple that's in line at the grocery store, you're waiting to pay for your groceries, and your toddler wants a candy or a chocolate bar from the checkout.
Yes.
Marketing wise, they have them all
Yes.
there.
Yes.
So, and you're busy doing things. You don't think it's a good idea for the child to have candy at this
Right.
point, and the child wants it. You say no. So that's your antecedent. That's what has led to
Okay.
it. That's your A.
Okay.
The behavior then is the child starts to cry, lies on the ground, is throwing things, hitting you, maybe, whatever
Right.
it might be.
Right.
And then C, this is the important part is, how do you respond, like you're saying?
Mm-hmm.
So do you say, okay, fine, here you go, right? And the child is connecting the dots. If I cry and I make this noise, then I get what I want,
Right.
right? Versus if you decline, they're also thinking, they didn't understand what I want. But I also understand that this is not how I get things, right? Yelling and screaming and
Right.
hitting is not going
Right.
to. So that's that pathway that from early psychology we have understood. It's the same thing actually with, most mammals
Mm-hmm.
as well. It's if I do this and I get something I want, so I'll do more of it. The
Right.
tricky part becomes, you don't want to completely dismiss your child. So you want them to know that my parents hear.
I listen. I care. Right. Right.
So that's the thing. You don't have to give in, but
Mm-hmm.
it is important to acknowledge them. So it
Okay.
might be something like, okay, you know what? I understand you want the candy right now. We can't have it. I know you're sad. Maybe another
Right.
time. And
Mm-hmm.
even just in having someone acknowledge and make you feel like you were heard and you were seen helps
Right.
to bring it down
Right.
50% or something.
Mm-hmm.
But just because you're acknowledging them doesn't mean you have to give in to them as well. You're still the parent. You have to make those decisions. But
Right.
I think thinking about when you have a troubling behavior in your child, what is that pattern that you're seeing? So if it is A, B, C, and you're like, oh, you know what, I am actually reinforcing this behavior, they're getting something out of it,
Mm-hmm.
then that automatically the brain thinks I'm going to do more of it, and the child starts to reinforce those sorts of
Correct.
behaviors,
I agree.
right?
I agree. Because, I mean, agree or not, every parent experienced this situation, and we actually do because I have a little one, so that's why this always uh, becomes a point of, you know, I won't say fight, but clash of difference of opinions between me and my partner. So sometimes she's on that side and I'm on this side, so vice versa.
And that's tricky. I would say, for couples, and especially if you have multiple people caring, for a child. So if you have
Yes.
grandparents or
Yes.
other people as well, so important to try to be on the same page so there's
Right.
consistency. Sometimes that's not possible. Ideally, the parents, you should try to be on the same page. If you can get grandparents or aunts and uncles to go along, that's fine. But kids quickly learn what they can get from some people and not from other people,
Oh
right?
yeah, they do. They do.
So, but at least with mom and dad or whoever's in your immediate household, if you can have that consistency, and you can trial different things, right? So even if you're having, conflict between both parents, and you're thinking, this is not something I want to do. I don't disagree with you. You can agree. Let's try this for 3 or 4 days. Let's try this for 3 or 4 days, and try different strategies as well.
Right, right, right. Since you brought that up, that they learn that this parent is gonna listen to or give in to my demands, and this one is not. Do they pick up a favorite person out of two in a longer course of time, or does that affect the relationship with the one who's being strict, or no?
Yeah, it's often the case, right? So when you have multiple caregivers involved with a child, children have different needs. So if you've got one parent in the household, or you have two parents, or if you have five or six loving grown-ups that are in the household,
Mm-hmm.
children often very quickly, as a part of their typical development, will pick up, this is something I like doing with, for example, like I like, coloring with my mom, but
Okay.
maybe I like wrestling with my dad, or going with for walks with them, or something like that. And I think you can enjoy your relationship in different ways. And it's
Mm-hmm.
tricky, and it can feel like you're the bad cop, we sometimes call it, if
Oh
you're
yes,
the
yes.
the parent who is the strict one, or who has to enforce the rules, or if you're the parent who's spending more time with the child while the other parent is away, perhaps for work or travel or something like that. So then again, trying to think about consistency, and as a parenting team, right, for whoever the grown-ups are, whether it's mom and dad, or if it's other people in the household, trying to think about, all of our goals are the same. We want this child to thrive. We want them to, grow, be independent, be confident, be successful with what we'd like for them, and to be content. So even if we're disagreeing in this moment, how can we come up with some plan? And but it is common for children to have favorites. It does change over time, just as their needs do as well.
Okay.
So
Right.
they may like more kind of silly play when they're younger, but they may like having a parent who's able to be there for conversations and more discussions closer to, or other types of support, depending on their
Yes.
developmental
Yes.
stage into
Yes.
adolescence.
Yes. Uh, Moving on to, I have seen you guys putting out, shout out to your Instagram page. That's where I discovered you from, and you are putting out a very informative content. Thank you so much for doing that and creating awareness around ADHD and all the other things that you guys are doing online. That's a commendable work you guys are doing, creating awareness around different topics, especially the ADHD, because I feel more and more people are aware of the symptoms, but they do not know what to call it, because they think that that's a normal thing that a kid can do, or they do that in the household. So we'll start from what exactly is ADHD, and how does it affect the kids behavior, and how are the symptoms of ADHD different from normal kids behaviors, please.
Yeah. Sounds good. Yeah, I think, we created the account. It created initially Punjabi Kids Health, and we created similar accounts for different communities as well.
Yes.
When we realized that, specifically within many of our communities, we don't have the same reliable access to information
Correct.
and science that otherwise is available broadly in English, or in, more mainstream sort
Right.
of platforms. A lot of it requires very high level of literacy and understanding.
Yes.
So we wanted
Yes.
to create nice bite-sized pieces, because we know it's present in every community.
Yes.
And when we think about behavioral health, it's not something that we talk about a lot. We don't, and it's kind of stigmatized, right? Where,
Yes. Yes.
especially with something like ADHD, so attention deficit hyperactivity disorder, the idea there is that, there's two subtypes. So you can have attention deficit, which is, difficulty paying attention. So that could
Mhm.
look like a child, or later an adolescent or adult, who appears forgetful. They may lose things. They may have difficulty with, paying attention to details of things. They may appear forgetful. So there's attention deficit, or you can have hyperactivity or impulsivity. So
Mm-hmm.
that can look like somebody who's, very fast with their talking, very busybody, has a hard time sitting still, hard time waiting for their turn, interrupting other people, and also difficulty controlling their, understanding and controlling their emotions and impulses. So it's almost
Mm-hmm.
like, this idea of um, acting first, but then pausing to think afterwards as well. So that idea of impulse control. All of the, both of these subtypes of ADHD are
Mm-hmm.
related, and
Mm-hmm.
sometimes they can look different in the same person. The different subtypes can manifest over time, over the years within the same person, or you can have a little bit of both. And when you think about those characteristics that I just mentioned, some of those are things that are expected from children. You expect as they're growing in the first few years of life, kids are learning to sustain their
Yes.
memory,
Yes.
sustain attention, those things. They're supposed to be busy and interactive and exploring their environments and learning and building their skills. It becomes a disorder when it's getting in the way of their functioning. So usually we say by around 6 years of age,
Mm-hmm.
right? For most parts of the world, that's around grade one level. Then that's when you're expected to be able to sit a little bit longer, sustain attention, organize your things at your desk a little bit more. But the idea there is if it's getting in the way of your functioning academically, behaviorally, in your relationships with others because you're considered to be disruptive, you're not, if you're, tuning out or inattentive 50% of the time, you're only understanding 50% of the curriculum
Mm-hmm.
as
Mm-hmm.
well, right? So when it's causing an actual impact or impairment in the day-to-day functioning for a child or maybe an adult as well, then that's where we would consider going in for an assessment with a specialist. So that would be through a doctor or a psychologist to get assessed for whether the child meets the criteria for a diagnosis of ADHD.
Okay.
And so it can look different in different kids.
Okay. Some of the symptoms that you said, that like speaking and later on thinking, I think that these are the things that children of 1 to 3 years usually do because they're not processing what they're saying. Sometimes they'd say they'll call mama papa or papa instead of mama, and they're talking to their mother and calling them father sometimes. But when what's the mark when it becomes repetitive, or okay, this is the problem mark, now I gotta go see a specialist?
Yeah. So I think, if you're concerned about your child's overall developmental milestones, like if they're walking on time, talking on time,
Mm-hmm.
go see your physician or your nurse practitioner, get assessed because these are not things we want to wait and see.
Okay.
So
Okay.
earlier to get identified, we know in many parts of the world there's a long wait list to see a specialist. So you're going to miss another number of months before, if your child needs some sort of intervention, if they need you know speech therapy, physiotherapy, occupational therapy, earlier is
Mm-hmm.
better depending on how their development of
Okay.
skills is going.
Okay.
Now around kind of these executive function pieces around behavior, really it's thinking about, is this impacting again their function? So it could be as early as if they're in daycare or childcare during the daytime. Usually
Mm-hmm.
by kindergarten, grade one, we start to see more of it because that's when kids are in larger groups with
Right.
fewer adults. They're
Right.
expected to follow routines, be able to interact with other kids in a reciprocal back and forth sort of way as well. So that's when your child, if they're having these concerns, may start to be a little bit more obvious or prominent because they're in a group of other kids who are a bit more
Mm-hmm.
typical, and you start to see the difference. But as the expectations from school and life start to go up around how you manage yourself and your behaviors and your attention and focus, then sometimes we start to see over time that kids are, left behind as the expectations continue to go up, and they
Right.
may need that extra support. The reason I mention the other parts of development is because all of these behaviors need to be taken into account in the context of that child's developmental skills, right? So
Okay.
if their thinking level is at the level of a 2, 3 year old, right, then we expect that their behavior and their attention will be at the level of a 2, 3 year old, which is brief, right? It's fleeting. They're trying, but
Right.
by the time you get to 5 or 6 years old, we're expecting that there should be more ability to be able to focus and attend to these tasks, to be able to
Correct.
care for your belongings a little bit more as well.
Correct. Correct. You mentioned this is still seen as stigma in adults. What exactly is this? Or is it just a situation in which a kid's brain is acting differently than somebody else? It's just their brain is acting in a different manner.
Yeah.
But how can we develop an understanding around this subject so that it becomes more inclusive in other people's lives?
Yeah, this is a really good question because generally we've been seeing more of a movement to this idea of what we call neurodiversity or neurodivergence, where neurologically our brain's wiring, there's a lot of diversity in how we are wired.
Right,
So
right,
as I've been talking about lots of different developmental skills. So, we all have different ways in which our bodies move, our coordination, how we learn to speak, how we listen, how we pay attention to things, our developmental skills across different domains of development. Some people are very good and some things come very easily to them. Other things don't come as organically to them and maybe a bit tougher.
right,
And if
right,
you look at all of our brains, there's so much difference, right? Even within families as well. And certainly if you look kind of within peer groups and whatnot. So that's this idea of neurodiversity. We are all good at some things and maybe we're not so good or need help with other things as well.
right, right,
The and so I think we've had more of a movement to thinking about when we think about things like autism, when we think about ADHD, learning disorders, these sorts of things. They've been given these terms, disorder, but really it's a difference in how our brains function.
correct.
The point at which we call it from a clinical standpoint, when I'm thinking about with my patients, is calling it if it's causing a problem in that child's ability to function and develop to their full potential. So if they're having a hard time paying attention, they are being disruptive, they are fighting with people, they're getting in trouble, it's impacting their self-esteem, their ability to learn in school, they see themselves as a bad kid. That's a trajectory that's quite worrisome.
Okay.
But if it's something where it's manageable, where the family understands, we understand how to manage this child's behaviors and to be able to support them, and same thing at school, if the symptoms are a bit milder, for example, they may not need a specific name or diagnosis related to it if they can kind of rework some of the strategies around them. So there's differences, I think, there. So I think part of it, again, is just from a diversity standpoint, thinking about you know, we're all good at some things. When we think about the ADHD brain in particular, there's lots of brilliant people who have done so much for our societies and communities who have ADHD diagnoses.
Yes, I agree, and I when I was reading about it, I mean they're great achievers. They're like I can say overachievers in some of the fields, and who has these symptoms, this situation, but they have still achieved great success in their lives. Yes,
Yeah, and ADHD, it often gives the brain the capacity to be able to, work well under stress often, to be able to be very spontaneous, to be creative, to be able to think of new novel situations and solutions to problems as well, to be some people are very outgoing.
yes,
And can have really wonderful magnetic personalities. So, that could be the makings of a great politician or artist or actor or musician. Lots of people with ADHD do quite well. The idea of intelligence is something different from how our executive function and
correct,
our
correct,
and all of
correct.
those things function. So
Yeah.
that's a separate story. But
Hmm.
part of it, I think, again, and this is what I talk about with our families in our clinic, is thinking about again, how do we support this child in their potential, where we know they've got these other things they're so good at. How do we make sure that these other things don't get in the way of that? And so with ADHD, we're talking about supports in school, strategies from a parenting and caregiving standpoint, sometimes medication as well. A lot of research shows that that helps in terms of long-term outcomes. These are all tools that are available to families as they
Hmm.
think about, how do we care for this child in the long journey.
That was my next question. How can we cure this thing, or is there any cure of this or at all or no?
So I wouldn't say there's a specific cure that would make it go away 100%.
Okay.
There are, so again, thinking about what is your goal for this child. So if the concern is, they are being disruptive in class, they're forgetting things, it's getting in the way of their academic functioning and self-esteem, those sorts of things. I think it's important to talk to a healthcare provider to look at whether the diagnosis fits. We always like to try first non-pharmacological interventions, so strategies for teachers and for parents and families on how do we support children who have ADHD.
Mm-hmm.
We know that some of those strategies can be having short periods where they have to focus. So rather than having an hour-long class, which may not be appropriate, can we break it into small chunks? Can we have them sit near the front of the class so it's easier for them to focus on what the teacher is saying, so there's fewer distractions? We know that physical activity, having that broken throughout the day for them as opportunities, can help them. Once you get that, we kind of say that it's kind of like getting the energy or your wiggles out, then you can come back and be able to focus again in class or at the task as well. So it's kind of those sorts of things have a lot of research that show that they work. If that's not the case, if your child is still, needs more support, then there's a lot of, within Canada, there's about 6 or 7 different types of medications that have been really well studied. We know them inside out and they've been used for many decades, which can be very effective. Most children, about 87% of kids, do well with the first medication that's trialed. And with a pediatrician or a psychiatrist, then the idea would be you start, one of them, you can trial it to see if it's helpful with managing some of those symptoms. And again, people sometimes worry that with medications that it's a forever thing. But most clinicians, I think, would agree that you can trial it and see, for a certain number of weeks or months, is it improving the symptoms? Is it helping with the goals that you're outlining for the child? It's a tool.
Do you, while your clinical practice, do you come around or encounter parents who have disbelief towards the medication of ADHD? Because as I told you, I was talking to the person, my friend, and the medicine for his kid, it's doing wonders. And he said that people really do not believe that, or they look at it, it's not a good thing to give a kid a medicine for a whole life, but what would you say to a parent who has a disbelief?
Yeah, so I think from a medication standpoint, it's tricky. I think we sometimes families want what they consider to be holistic sort of approaches or things, committing to trialing medication feels like a big jump for some families and there's reluctance around it. I think, there's more and more research that's showing that, the more that we wait, it becomes harder to impact, have a positive impact on those behaviors long term. So, there was recently a study. So, when we look at medications in Canada, the guidelines are usually 6 years and up is where the medications are approved for use. So, most of us are very vigilant and are very careful about, choosing the right medication, waiting for the right time. And then we always start with a very low dose and then increase according to the right balance of how much is helping before we start to see side effects that might be bothersome. So if it's increasing, difficulty with sleep or less appetite, things like that. So those short-term sort of side effects we watch for. And we rely on families and teachers to tell us how much is enough, but how much is too much to find that sort of window. So actually some families get a little bit tired because we are very careful about taking our time to adjust it to the right level and not going too quickly and aggressively with the dosing. So it's something as clinicians we take very seriously around what is the right dose. These are also medications we know very well. It can be tricky where I think, I know within my practice and in my personal networks where people have said, let's just wait and see what happens. Let's see if things get better. Or what if we try other sorts of remedies like herbal remedies or homeopathic remedies, things like that. That becomes tricky because on one hand, with these medications, they've been tested so well and so long that we know the good and the bad, right? We know
Right.
this is how they're going to work. We know that these are the side effects to watch for, and we know them quite well.
Right.
If you're going to a practitioner that's not licensed and they're sharing things with you to give to your child and you're not totally sure what's in it,
Right.
right?
Right.
That's also troubling as well that we would give that
Yes.
to our child, but there may be something that's harmful in it as well. So as a family, you have to kind of think about what do you feel comfortable with? At what point, what is the breaking point or what's the threshold where you would say, okay, let's trial medication. From my standpoint in practice, it is usually, like I was saying, if it's impacting child self-esteem where they're saying, I'm bad, I'm dumb, I'm struggling at
Right,
school, and
right,
it's
right.
they're starting to internalize that. That's pretty major for a young child.
Yes, yes.
And also if it's affecting, how other people are seeing him or her, classmates, teachers, etc., where they're getting a bit of reputation for being disruptive or whatnot. So I think it can be tricky for families, but it's important to have those conversations. The time thing I was talking about, so there were some recent studies that came out of the States which looked at, what is the right time? What is the threshold? So I think, once you get to that 10 to 12 year sort of range, you're starting to get to a point where if you've started ADHD medication before that,
Mm-hmm.
we know that children are still learning and building behavior, so you can still positively impact. They get into a headspace where they can build more positive habits around studying and focusing and relationships, etc. As you get older, starting medication later, you've already built those habits. Your brain is already
Right,
wired, and you have those sort of reactions of this is how I'm going to react if something happens. So it's some of the behaviors around that have already started to become hardwired. When you start medication after that, the studies are showing there is still a benefit. So young below that 10 to 12-year-old sort of threshold, we see that it can impact children's self-esteem, positive impact on their health overall, and actually positive economic outcomes, because those kids are more likely to stay in school, do well in
yes,
school, and do better in terms of careers and economics down the
right,
road.
right.
After that, when you're starting after the 10 to 12-year-old sort of mark, then you're getting to a point where they may do better in school, but the longer term outcomes around mental health and economic and career outcomes is less.
Okay.
So I think these are things where, you don't want to be waiting to high school, ideally. I'll also say it's never too late because the medication's still helpful, but for families who take a long time thinking about it, there is, the brain's wiring itself, it's getting more hardwired as the foundations are building as children get older too.
Yeah. Do you think there are any common misconceptions about ADHD that people have and that you would like them to know that that's not true?
Yeah, I mean, from a medication standpoint, I know people worry that, starting a medication, the child is going to get addicted to it, that they have a higher risk of having, a dependence on medications or
Hmm.
drugs in the future. A lot of the research actually shows the opposite, that for children who have ADHD, when they get to be teens, they're actually better able to manage themselves. They're less likely to try recreational drugs, to
Right.
be involved in risky behavior because they're able to,
That's a
again,
big
pause
risk
and
too.
think through it,
Yes,
right?
yes,
Because
yes.
that's something that is commonly encountered in adolescence. But actually, these medications help to protect your child so they can think through those behaviors before trying those things. So it's kind of the opposite, actually. But that's a common misconception around then reliance on medications, etc.
Hmm. Right. Uh, have you seen any increase in awareness about this topic, and how can we do more about it? How can we make aware people more aware of this scenario and develop their understanding around this?
I think, having conversations like this is really important. Understanding that this isn't something that just happens in other communities. ADHD is common, throughout the world across different cultural and linguistic groups. So I think having awareness is important. Being open to exploring it. So if you're a parent and you're concerned about your child, go see your practitioner. Ask the questions. Ask for more information. The other sort of thing that's a bit tricky is there's so much information online. It's hard to tell what's mis and disinformation, what's true, right? So it's important to use trusted sources, and
Yes.
with it, to we think of it kind of like, triangulating or getting lots of different sources, so you can rather than listening to one thing and trusting that on its own as well. So going to those trusted resources, I think, is important, but having these conversations and then thinking about both, it's not, it has this stigma that's attached to it being a disease, like you were saying earlier, Vishesh. It's it's a part of, it's a different way of thinking that has its strengths. But if you're getting to a point where it's getting in the way of that long-term potential developmentally, it's causing those impairments, and that's when it's time to think about getting support. So I think, even, when we talk within our communities and families about someone who has ADHD, it shouldn't be with stigma, but it's just, again, curiosity and understanding about how their brain and their functioning may be different.
Right. Uh, Thank you so much, doctor. Thank you so much for your time. That's pretty much all. I I mean, not all actually, to be honest. I have a lot of questions I want to ask you, but I know we are on a time constraint, and I'd stick to that time frame that we have for today. Again, thank you so much. I really appreciate what you are doing offline and online. And I'm a fan of your work, especially shout out to your Instagram page, the Punjabi Kids Health and Our Kids Health. And we will be in touch, and maybe we'll talk again soon whenever you get time to.
Sounds good. Thank you so much for the time today.